Okay, this is going to be my tuning fork. We have blood pressure cuff. This is going to be what I'm going to use to occlude the eye during the Snellen eye exam. This is my stethoscope. This is my pen light. Just want to set this up at a good angle.
Want to move closer?
No, I think that's good.
Okay. Come in.
Hello.
Hi.
How are you doing today? My name is Matt, and I'm going to be your nurse today.
Hi, Matt. I'm Randy.
Today we're going to be performing a full physical assessment directly from the top of your head to your shoulders. All information taken today is going to be documented into your electronic health record. All of that information is going to remain confidential. It can only be viewed by yourself and any of your healthcare providers. Do you have any questions about that?
No.
Before we start the exam, let me just shut the door over here. Make things a little more private and comfortable for you. Do you have any questions? Do you feel like the environment is safe?
Yes.
Comfortable? No questions?
Not right now.
Great. So before we begin the exam, I'm just going to do some hand hygiene. Let me just grab my hand sanitizer over here. Do some hand hygiene. Great. Put that back over there. Do some hand hygiene. Don't want to spread infection. So I'm just going to begin by getting some vitals. If you could just roll your sleeve up for me. Great. Now I'm going to feel for your radial pulse. I'm going to time that for 30 seconds, okay? Great, so your radial pulse was 32 multiplied by 2 was 64. Now I'm going to take your blood pressure. Stethoscope. Perfect. So I'm able to fit 2 fingers in the cuff. You could rest your arm, relax your arm. Just like that, good. The arm is at heart level. Okay, perfect. Your blood pressure was 120 over 78. Which is perfect. So now I'm going to begin the assessment from the top of your head
Okay.
all the way down to your shoulders.
Mhm.
So I want to start with your face. I'm going to ask you a couple quick questions.
Mhm.
Any acne?
No.
Any face pain?
No.
Any recent head injuries?
No.
Frequent headaches?
No.
Great. So just looking at your face, I see it's free of bruises, no lesions, no acne, no discoloration. All your facial features look symmetrical. Your head is of a normocephalic shape. It is proportionate to the rest of your body.
Mhm.
Could you do me a favor? I want to test cranial nerve number 7. Could you just smile for me? Could you frown? Great. Could you blow up your cheeks with air? Perfect. So cranial nerve number 7 is working just fine. Now I just want to inspect the top of the patient's head. Is that okay if I inspect the top of your head? So what I'm going to do, I'm going to palpate. Is this painful?
No.
Patient has no pain, no lesions, no bruising, no discoloration. Top of the head is intact and free of pest inhabitants. Patient does not have lice. Everything within their facial structure as well as the top of their head is intact. All of the findings just mentioned are expected older adult findings. 3 expected older adult findings would be loss of moisture from the skin. Another one could be a rhythmic tremor of the head. And another one could be a more bony prominence of facial features due to the loss of subcutaneous fat around the face. So now I'm going to assess the patient's eyes. Any eye pain? I just
No.
want to ask you a couple questions before we start. Do you have any eye pain?
No.
Have you noticed any discharge or swelling or tearing
No.
coming from the eye? Any decrease or loss of vision recently? No, great. So upon looking at your eyebrows, eyelids, and eyelashes, they all appear to be symmetrical. I don't see any bruising, no lesions, no discoloration, no abrasions. Everything within the patient's eyelids, eyelashes, and eyebrows appear to be intact and normal. Now I'm going to assess the patient's pupils. So upon looking at the patient's pupils, they appear to be equal, round, and of regular size, which is perfectly normal and what we want the patient to have. Now, I'm going to assess your reaction to light. So if you could just back up a little bit for me, I'm going to just have you back up. Perfect. You come to the center of me. Perfect. So I want you to just focus at a spot directly on the wall, back there. Don't look at me.
Okay.
So what I'm going to do is I'm going to come in from a side angle with my pen light,
Mhm.
and I'm going to assess your pupil's reaction to light.
Okay.
Okay? Perfect. We're going to do the other side now.
Mhm.
Perfect. So we have a direct light reflex as well as a consensual light reflex. The direct light reflex is in regard to the pupil that's receiving the eye. There's constriction of that pupil, and then there is simultaneous constriction of the pupil that is not receiving the light. That is the patient's consensual light reflex. The patient demonstrated a direct light reflex as well as a consensual light reflex. Now I want to test your accommodation.
Mhm.
So I'm just going to have my light shining right here, and I'm going to bring it closer to your nose, okay? Just follow my light. Perfect. So the patient's eyes converged and their pupils constricted, demonstrating that they have proper eye accommodation. Now what I want to do is I want to assess cranial nerve number 2. So if you could just turn around and look at that eye chart for me,
Mhm.
right on that, back up a little bit. So, yeah, there you go. So we want to get you at 20 feet.
Okay.
You see the eye chart, the Snellen eye chart
Yes.
on the wall? I want you to take this piece of paper and I want you to occlude your right eye. So cover your right eye.
Okay.
And I want you to read the second line from the bottom.
A, B, C, D, E, F, G.
Perfect. Now switch.
A, B, C, D, E, F, G.
Perfect. So cranial nerve number 2 is intact. The patient has 20/20 vision. What that means is at 20 feet of distance, they are capable of seeing what a normal eyeball should be seeing at 20 feet of distance. Now what I want to do is I want to assess your cranial nerves number 3, 4, and 6. How we're going to do this is through the 6 cardinal fields of gaze test. So what I'm going to be doing is I'm going to be moving my pen light around, but I only want you to track the light with your eyes. I don't want you to move your neck, okay? So just focus on my light with your eyes. Good. 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 Let's do the other eye. Good. 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 So the patient demonstrates parallel tracking of the light as I move my pen light. So the extraocular muscles of the eye are working just fine, and cranial nerve 3, 4, and 6 are intact, and they are working perfectly, normally, and fine. They are intact. So now what I'd like to do is I'd like to examine the inner workings of your eye. I'm going to be looking at the retina, the cornea, the macula, the physiologic cup, the optic disc, okay? And I'm going to be using my ophthalmoscope for this. Great. So I see your retina. I'm getting a red light reflex, which is a red glow within your pupil due to light coming from my ophthalmoscope, which is completely normal. I see the patient's retina. The retina is a healthy orange color with vasculature in all 4 quadrants of the retina. The macula is present, and it is a darker color than the retina. The optic disc as well as the physiologic cup are present, and those are lighter in color than the retina. Now I want to do the same exact thing on the other side. Perfect. Same exact results on the other eye. So all the findings stated were findings that would be expected you would find in an adult. So 3 older adult findings you would expect to find would be a sunken appearance of the eye due to a loss of subcutaneous tissue in the orbital area of the face, a decrease or loss of vision, as well as presbyopia. That's going to conclude the assessment of the eyes. Now I want to take a look at your nose region and your sinuses. So a couple quick questions before we start that. Do you have frequent nosebleeds?
No.
Frequent nasal discharge?
No.
Severe colds, frequent severe colds, common hay fever, anything like that? No? Perfect. So now what I'm going to do to start the assessment, I'm going to palpate the client's maxillary sinuses. So if you could just come. Perfect. Is this painful?
No.
And I don't feel any tenderness, so that's great. Now I'm going to palpate the patient's frontal sinuses on the forehead. Is this painful?
No.
And I don't feel any tenderness, so that's great. So upon looking directly at your nose, it appears symmetrical, unbruised, not broken. I don't see any lesions, no skin discoloration, which is great. Now, could you just cover one nostril for me like this and breathe in? Exhale. One more. Let's switch nostrils. One more. Perfect. So the nostrils are patent. Now I would like to test cranial nerve number 1, which would be your sense of smell. Now, if you could just smell this for me and let me know what it smells like.
Coffee.
Perfect. Awesome. Cranial nerve number 1 is working just fine. So now what I'd like to do is examine your internal nares. So I'm going to take my otoscope and I'm going to examine the patient's internal nares. Perfect. So what I am seeing is the patient's internal nasal mucous membranes are present. They are a normal, healthy red color. Normal, healthy cilia are present. There are no polyps. There are no nodules within the patient's internal nare on the right side. Also, the patient's septum is not deviated and it is in midline. Now I'm going to inspect the patient's left internal nair. Perfect. Again, same results. The nasal mucous membranes are present, they are intact, they are of a normal red color, there is normal healthy cilia present, there are no polyps, no nodules are present, and again, the septum on the left side of the patient's internal nairs is not deviated and it is midline. That is going to conclude the nasal as well as the sinus assessment. I'm sorry, I actually forgot. I want to just transilluminate. I want to test your sinuses for transillumination. If you could just close your eyes. Sorry about that. I forgot that step. Could you just tilt your head a little upward with your eyes? Perfect. Perfect. So the patient's sinuses do transilluminate due to the red glow that is being caused by the light within their inner canthus. So now that will conclude the nasal assessment. All of these findings stated are expected findings within an adult. 3 expected findings within an older adult would be an increased size in the nose due to a loss of subcutaneous fat all over the face, an extreme or protruding dipping tip of the nose due to a loss of nasal cartilage, or a decrease or loss of sense of smell. Those would be 3 expected findings in an older adult. So now we're going to move to the assessment of your mouth and your throat. I want to ask you a couple of questions. Any difficulty swallowing?
No.
Any lesions within your mouth?
No.
Any frequent or severe sore throats, anything like that? Any notice of a change in your voice, hoarseness, cracking? No, perfect. So I want to just start off by testing cranial nerve number 7. If you could just stick your tongue out and move it side to side? Perfect. So cranial nerve number 7 is intact. Cranial nerve number 7 controls tongue function. So now, looking at your lips, your mouth from an external point of view, they look symmetrical. They look just fine. I don't see any bruising. I don't see any lesions. Everything looks symmetrical. There's no cracking on the patient's lips. Everything seems to be intact. Now, could you just open up your mouth for me, please, and say ah? Ah. Stick out your tongue. Ah. Perfect. So the uvula moves upward and backward, which is exactly what we want. Could you open your mouth for me one more time? Could you stick your tongue up, down? Perfect. So upon examining the patient's internal structures of the mouth, I noticed that there are no lesions, there are no abrasions, no sores, no discoloration underneath the tongue. The same applies for the top of the tongue. No lesions, no abrasions, no discoloration, no sores on the top of the tongue or anywhere throughout the internal structure of the patient's mouth. The patient's teeth appear to be of normal white color. The mucous membranes within the patient's mouth appear to be a normal light pink, healthy color. The patient's tonsils are intact and free of inflammation. There's no infection present within the tonsils. The tonsils would receive a size grade of +2. Could you just open your mouth for me one more time? Perfect. The oropharynx is present. It's intact, uninflamed, healthy. Now I want to inspect for the Wharton's and Stetton's duct. Okay. Perfect. So the Wharton's and Stetton's duct is intact, it's not blocked, and it's exactly where it should be, right next to the second molar. So now I'm going to do an assessment of the patient's neck. So just looking at your neck, it looks intact, it looks healthy, it looks normal. No bruising, no skin discoloration, no lesions, no acne. It looks very free and clear. The patient's trachea is in midline. It's not shifted more to the left or right side. It's perfectly as it should be. And I'm sorry, before we started, I forgot to ask you, are you experiencing any neck pain?
No.
Any swelling in the neck or anything like that?
No.
Sore throat, frequent sore throats?
Nothing.
No?
No.
Okay, perfect. So now, So now the trachea is midline. There's no shift to either side. Now what I want to do is I want to palpate your lymph nodes. So I'm going to, is that okay if I? Preauricular. Preauricular. Posterior auricular. Occipital. Submental. Submandibular. Jugulodigastric. Superficial cervical, posterior cervical, supraclavicular. Was that painful at all?
No.
So the patient's lymph nodes were not palpable, they were not tender, they had no pain, which is what we would expect. Totally normal, lymph nodes are intact. No sign of infection, no bruising, no lesions, everything's perfect. These would be expected findings within an adult. So 3 expected findings within an older adult would be an anterior curve of the neck. There may be lowering of the submandibular gland on an older adult, as well as an older adult may experience dizziness with lateral range of movement when they move their neck. So if they're moving their neck laterally, they may experience dizziness. So now, finally, we're going to move to the assessment of your ears. So, you just look at me directly. Looking at the patient directly, the ears appear to be symmetrical. Now, could I just turn you? From the side, the ear line, the pinna of the ear lines up directly with the outer canthus of the eye, which is exactly what we want and perfect. Now, is it okay if I palpate your external ear? Is there any pain?
No.
No pain? Any pain?
No.
So the tragus is free of pain as well. No lesions, no swelling, no abrasions. The external ear appears to be totally healthy and intact. So now I want to perform 2 hearing tests on you. The first is going to be a whispered voice test. What I'm going to do is I'm going to whisper a couple of words or numbers in your ear, and I want you to repeat them directly back to me, okay?
5, 4, 3, 2, 1.
Correct. Now I'm going to do the other ear.
5, 4, 3, 2, 1.
Perfect. Now I'm going to conduct one more hearing test. This is going to test your bone conduction. So right here, I have my tuning fork. Okay. This is the base of the tuning fork. These are the tongs of the tuning fork. So now what I'm going to do, I'm going to bang the base, and I'm going to place the base on your occipital bone. When you are no longer able to hear anything, you let me know, and I'm going to switch it to the tong side right in front of your ear, right here by your temple. I'm going to ask you, can you hear this? You let me know, okay? Ready?
No. I can't hear anything anymore.
Great.
Now I hear it.
Perfect. Let's do it on the other side.
No, can't hear anymore. I hear it.
Perfect. So air conduction is greater than bone conduction. Patient's hearing is just fine. There's no abnormalities. All of the findings discussed would be expected findings for an adult. 3 expected findings for an older. I'm sorry, I forgot. Before we move on, I need to examine the inner portion of your ear. I'm so sorry.
That's okay.
So I just wanted to take a look in the inner ear. Perfect. So I see the tympanic membrane. Tympanic membrane is a dull gray color. There's no overly excessive amount of cerumen within the right ear. The cone of light is appearing at 5 o'clock, which is exactly where it should be. Now I just want to do the other ear. Perfect. I'm conducting this with an otoscope, by the way. This is not a pen light. Perfect. Same exact result. I was able to see the eardrum. I was able to see the tympanic membrane. The tympanic membrane was a pearly gray color. The cone of light on the patient's left ear appeared at 7 o'clock, exactly where it should have, or exactly where it should be. There was no excessive amount of cerumen as well. Overall, the ears are perfectly normal, healthy, intact. All of these findings would be expected findings within an adult. 3 expected findings within an older adult would be the presence of an excessive amount of cerumen, a decreased loss or sense of hearing, as well as the appearance of a pendulous earlobe with linear wrinkling on each earlobe. So that concludes our full health examination from the top of the head all the way to the shoulders. Do you have any questions for me?
No, thank you.
So thank you for being so cooperative with me. It was a pleasure examining you.
Thank you.
You are very healthy. I do not see any problems with you. Like I said before, I'm going to go document this information into the electronic health record.
Mm-hmm.
That remains completely confidential. Nobody but myself, because I'm a nurse and I'm one of your healthcare providers, or any healthcare provider that is treating you can view that information. You are confidential and you are safe here. Okay?
Okay.
Thank you so much again for being cooperative, and I am just going to perform hand hygiene one more time before we exit. And again, it was a pleasure
Thank you.
examining you.
Thank you.